Progressivism is a social reform movement that developed in America during the Progressive Era, which stretched from 1880 to 1920. It was the first social movement in the U.S. to address urban issues such as child labor and unsafe working conditions. In the early stages of America's industrial society, much of the population was made up of immigrants drawn to the promise of prosperity. By 1914, new immigrants made up 23% of the American population and 60% of the workforce. A lack of public health, building, and housing regulations made life quite dangerous for those in the workforce. During the Progressive Era, around 35,000 Americans were killed and 536,000 were injured every year due to the absence of regulations. Before the Progressive Era, American government was relatively small and filled with corporate interest. The Depression of 1893 brought with it a new wind of distrust for corporations and forced Americans to reevaluate the idea that hard work alone brings about prosperity. The curtain had been drawn back and revealed bribes and special treatment that served to spark the drive for social reform. While much of the middle class supported reform, many didn't understand what it was like for those that needed the most help. Jane Addams, also known as America's Reform Goddess, started a settlement house called the Hull House. The Hull House was a determined effort to live among those that experienced social issues firsthand so that legislation could be written that fit those that needed it the most. It also served as a microversion of the society that Addams wished to create, one that replaced America's competitiveness and self-seeking ambition with compassion and collaboration. Prior to the Progressive Era, healthcare in America was fickle. Epidemics wiped out 20% of city populations, and a lack of sanitation regulations made for a wonderful breeding ground for disease. Progressive Era reform brought about public health centers in which Americans could receive inoculations, public health inspectors enforced new sanitation regulations, and licensed medical schools served to greatly improve the education of physicians. Patients had to pay physicians personally, though, which made doctors private entrepreneurs in a capitalistic society. This led to many people not getting the treatment they needed because they simply could not afford it. The American Medical Association argued within itself about universal health care, but it was eventually scrapped and called socialistic and un-American. The presidential campaign of 1912 proved to be an important time for the reform movement, as they realized they would not be able to make any significant progress without their own place of power in American politics. A new progressive party was born to contend with the traditional bipartisan system with its own nominee, Theodore Roosevelt. Unfortunately, the election did not go in the Progressive Party's favor. The Democratic nominee, Woodrow Wilson, won the presidency, and the Progressive Party eventually fizzled out by the congressional elections of 1914. In 1919, 15 schools of social work formed the Association of Training Schools for Professional Social Work, and by 1920, social work rose to its status as a profession. While the Progressive Era can be seen as a roller coaster of social reform, without the progress made during this time, we wouldn't have the social welfare systems that we have today.